All right, let's get right into it. If you or someone you care about has gone through bowel surgery, you know that understanding the recovery can feel, well, pretty overwhelming. So today, we're going to break it all down in a completely different way. We're going to use a really powerful analogy that I think makes the whole process so much clearer. So forget the complicated medical jargon for a minute. We're taking a trip to a construction site. Okay, so here's the big idea. Think of a bowel resection, or really any surgery on your gut, as a major plumbing job. Seriously, the surgeons have to cut out a bad piece of pipe and then join the two ends back together. But here's the catch. This pipe is buried deep under a fresh slab of concrete, which is, your own body tissue. And just like real concrete, you can't just start walking all over it right away. Everything, and I mean everything, depends on giving it time to set and cure properly. And that brings us to the most critical phase of the whole project, that first week. This is all about letting that foundation set, protecting the new pipework, and, having a whole lot of patience while your body does its thing.
Now, let's translate a couple of these medical terms into our construction project. It's actually pretty simple when you look at it this way. Your incision, that's the formwork, the wooden frame that holds the wet concrete in place. And the anastomosis? That's the really crucial spot where the bowel is reconnected. Think of that as your pipe joint. Getting these two things right is the key to the whole recovery.
So let's talk about that formwork, your incision. In that first week, it's just held together by stitches or staples. If you put too much strain on it, say by lifting something heavy, you risk a blowout. The whole thing could just give way. This is exactly why your doctor tells you no heavy lifting. You wouldn't try to move a bunch of heavy cement bags around a freshly poured foundation, right? Same idea here. And this right here, this quote really gets to the heart of the whole operation, the pipe joint, the anastomosis. This is the most delicate, the most vital piece of the entire repair. Pretty much everything else in your early recovery is just designed to protect this one single connection and give it the time it needs to heal and become completely sealed. So how much time are we talking about? About 5 to 7 days. That's the magic window. Just like a concrete slab needs time to cure and get strong, this new pipe joint needs about a week before it's truly watertight. If you push the system before that curing time is up, you're really just asking for trouble. So during this curing time, how do we know if there's a problem? Well, you gotta check for leaks. If that joint leaks before it's fully set, it can cause a really serious infection. So when the doctors and nurses are constantly checking your temperature and your heart rate, think of them as the site foreman, checking the concrete mix, looking for any sign that something's not right with the cure. All right, so once that initial cure is underway, the next big challenge is getting the whole system up and running again. Because after a major surgery like this, the gut often just stops working for a little while. We've got to get things flowing again so we can pass that slump test. The medical name for this shutdown is an ileus, but honestly, the definition here says it all. The gut basically goes on strike. And this analogy is perfect. It's like the big concrete mixer truck just stopped spinning, and everything inside is just sitting there, threatening to harden up. We have got to get that mixer turning again. So, how do you do that? Well, it's pretty much this 4-step process. First, the mixer stops. That's the ileus. The solution? You have to walk. Walking is like the vibrator they use on a concrete pour. It literally shakes everything up, gets things moving, and helps get the flow started again. And that leads to the next very crucial step. And that next step is passing gas. Yeah, it might sound a little funny, but it is the single most important sign that the system is waking up. It's literally the sound of air clearing the line, proving the pipe isn't blocked. Until that happens, you have to stay on a liquid diet. You don't want to send solids down the pipe and cause a major clog before you know the line is clear. Now, just because the system is running again doesn't mean the job is finished. Not even close. The next phase is all about building that deep internal strength. This is where your body really starts laying down the rebar. And what is that rebar? It's a protein called collagen. As you heal, your body goes into overdrive producing this stuff, laying it down like steel mesh inside your tissue. This is what gives that repaired area its real long-term durable strength. It's what turns a fragile repair into a tough, resilient structure. And this process, well, it takes time. At 1 week, that new tissue is still what they call green, like fresh concrete. It's fragile and weak. After about a month, it's getting a lot stronger. But it can take 6 months, or even more, for that internal structure to become fully cured and as tough as it's going to get. So this is so important to remember. Even when your incision looks perfect on the outside, and you feel pretty good, The real construction project is still happening deep inside. That internal concrete is still curing, it's still gaining strength for a very, very long time. And that's why you have to slowly and carefully return to your normal activities. And finally, like any good construction project, you've got to have a safety plan. You need to know the red flags, the signs that tell you it's time to shut down the pour and call for help immediately. These are your absolute non-negotiable warning signs. If your belly gets hard and bloated, that's like the slab is heaving. If you see pus or feel a lot of heat coming from the incision, well, the mix is contaminated. And if you feel a sudden pop inside or the incision actually opens, that's a blowout. Any of these happen, you call your doctor, the site superintendent, right away. No hesitation.
Look, it's that simple. You're the one on the job site every single day. If you see signs of a major problem, like a big storm rolling in, you don't just keep working and hope for the best. You stop everything and you make the call.
And that brings us to the end. We've covered the foundation, the pipes, the cure time, and the safety checks. So this leaves us with one last really important question to think about as you move forward. What's the right dietary mix for you during these crucial first few weeks of the cure? And that is the perfect conversation to have with your healthcare team as you oversee the rest of this very important construction project.